Hi everyone, welcome back to my channel, The Learning Anatomy by Dr. Venu Madhav. Today we will learn about the anatomy of the human tongue. You know the tongue is a very important organ which is present in the mouth and it is used for the sense of taste. But in anatomically we define the tongue as a solid conical muscular organ because it is solid full of muscles and conical in shape and it is covered partially by the mucous membrane. Why it is partial? Because the base of the tongue which is attached to the floor of the mouth is not covered by the mucous membrane. So if we talk about the uses, the main use is the taste, then speech, facial expressions, then it keeps mouth and lips moist and grasps the food during mastication and helps in mixing the food, swallowing the food, and it indicates so certain diseases and some in lower grade animals it regulates the temperature. For example, in dogs the panting is the best example for this. So where is the tongue? If we open the mouth we will see only a part of the tongue because the other part of the tongue is present in the throat, what we call pharyngeal cavity. So based on this location, the tongue, the anterior 2/3 of the tongue is in the oral cavity, while the posterior 1/3 is in the pharyngeal cavity, what we see. So if we cut the face into two equal halves, right and left, so that is called sagittal section, we see the tongue in this fashion. You can see the anterior 2/3 of the tongue is in the oral cavity, and from here the posterior 1/3, the posterior 1/3 is there in the pharyngeal cavity. So based on this, what are the parts of the tongue? The anterior 2/3 you can see here, while protruding our tongue outside the mouth, you can see small elevations on the back of the tongue, what we call valate papillae. Behind them there is a V-shaped sulcus here. So with this sulcus, what we call sulcus terminalis, the tongue can be divided into an anterior 2/3 and a posterior 1/3. This posterior 1/3 forms the base of the conical shape of the tongue. The anterior 2/3 is free and it moves freely in the oral cavity and it has a narrow tip or apex which is touching the back of the teeth. And you can see the two sides, the lateral margins, what we call right and left lateral margins are there for the tongue. These are the basic parts of the tongue. If we see another section here, because the tongue is attached between the mandible, that is the lower jaw bone here, and another bone is there in the throat, what we call hyoid bone. So the part of the tongue which is attached to the these two bones along the floor of the mouth is called the root of the tongue. From here to here, the root of the tongue. So this is the base, and you can see the sulcus terminalis here, and this is the apex which is touching the back of the teeth. So this is the sagittal section of the head which divides the head into right and left halves. So just what we mentioned, apex is directed forward and in contact with the incisor teeth. Base is formed by the posterior 1/3. Why it is important? So you can see the base is connected with the epiglottis because if you open the mouth of a young child who is lean, you can see a small projection into the throat, what we call epiglottis. This epiglottis is connected, this is the tongue, what we see here, the posterior 1/3. So the mucous membrane of this tongue extends onto the epiglottis as three folds. One is in the center, what we call median glossoepiglottic fold, from the tongue to the epiglottis. Glosso denotes the tongue, and two lateral glossoepiglottic folds. There is a depression between the median epiglottic fold and the lateral glossoepiglottic fold. This is called epiglottic vallecula on either side of this median glossoepiglottic fold. Sometimes the food particles may obstruct here, causing very much disturbance. So this is the place what we call valleculae. So, if we see the basic structure, what we call anatomy of the tongue, that tongue consists of three types of tissues. What we see in the oral cavity, the pink colored mucous membrane, and you can see so many elevations on that, which are called the papillae, the mucous membrane and papillae, and below which you will see the skeletal muscles in different directions. Why skeletal muscles? Because we can control our tongue. The skeletal muscles are voluntary and they can alter the shape and size of the tongue, so which is useful in both mixing the food and the speech. So that's why the skeletal muscles are there. And we see connective tissue which connects the skeletal muscles with each other, the skeletal muscles to the mucous membrane, and also they conduct or they provide the passes for the blood vessels, lymphatics, nerves, and also this connective tissue consists of some glands. So this is the basic structure of the tongue, which a medical graduate should remember, because this is important both developmentally and structurally. So if we see the surfaces, again the dorsal surface or the upper surface of the tongue is there. It is extending from the tip to the epiglottis, and the ventral or lower surface, which is somewhat incomplete because only the anterior 2/3 will have, which is free in the oral cavity, will have the lower surface. Behind that, the lower surface is included in the root of the tongue, which is not covered by the mucous membrane. So this is called the ventral surface. If you see here, just what we mentioned as a little bit earlier, the dorsal surface is convex on all sides and covered by the moist and pink mucous membrane, and it is divided by a V-shaped sulcus, what we call sulcus terminalis, into an anterior 2/3 and a posterior 1/3 part. We can call it as pre-sulcal part and post-sulcal part. So if we see, the sulcus starts from a central depression. If you see this diagram, there is a small depression here. So this depression is called the foramen cecum. Cecum means a blind pouch. So it is a blind foramen which is present here. During development, that is the place from where the thyroid gland starts its development. So that is called foramen cecum. So that divides the anterior 2/3 and posterior 1/3 of the tongue. This entire thing is the dorsal surface. But the ventral surface is not like that, because the ventral surface is extending only in the free part. So we'll see what we see on the dorsal part. If you see this previous diagram, this is the same diagram again. You can see so many V-shaped parallel rows of elevations, or you can see grooves or elevations here. So many elevations are there. These are called papilla. So all you can see, this is the papilla. So if we talk about pre-sulcal part, that is anterior 2/3, the mucous membrane is adherent to the underlying lamina propria. The lamina propria, which is the tissue present just below the mucous membrane, and that presents 4 types of papilla. So what are the papilla? Those are the elevations. Those papilla are called valate papilla, fungiform papilla, filiform papilla, and foliate papilla according to their shapes. So we will see one by one. You can see this is the valate papilla. You can see fungiform papilla and filiform papilla. Foliate papilla are usually not seen so clearly in human tongue. They are more prominent in rabbit. So these are the different papilla. What you see, you can see this white core. This core is the lamina propria, and this is the epithelium of the tongue. So the epithelium of the tongue, as the friction is more, that is usually made up of stratified squamous epithelium, which is non-keratinized. But the tips of this filiform papilla usually are keratinized. That is the specialty and or the exception which we see on the papilla of the tongue. So this is the valate papilla. Velum. Velum means this wall. The outer wall of this is called velum. Just like this sulcus, this is called circular sulcus, and the central elevation is there. If we take a section, you can see central elevation is there, and there is a sulcus, there is a groove between these two walls. Just like the water filled canals around a fort. So this is a circular sulcus around this central papilla. So this entire thing is called valate papilla, and the outer wall of this sulcus is called velum. The food after being churned, that enters this groove and mixes with the secretions which are present here, then that stimulates these taste buds, because the walls of this papilla will have taste buds, and these taste buds will cause the sensation of the taste. So this is what we call valate papilla. You can see to provide the mixing of the food, the serous fluids, that means watery fluids, are secreted here by means of these glands, what we call von Ebner's glands. These are called ducts. You can see the ducts of these glands are opening into the floor of this velum, where in the wall of the valve, these valate papilla, you can see these are the number of taste buds will be seen. This is what we see the electron microscopic view of the valate papilla. And you can see the other papilla. You can see this is the section of valate papilla in a microscope. You can see the wall is presenting so many taste buds. Likewise, the fungiform papilla, fungiform just like a spore, and it has a rounded head, and the taste buds are present on its upper part and walls. And this is the filiform papilla. Usually filiform papilla will not have any taste buds. You can see this part is cornified, what we call keratinized or the cornified, because it is very rough, and which helps in holding the food during eating. So that's why these are more prominent in lower grade animals. That's why the tiger's tongue will have more this, and if it licks, the skin will rip off. So these are the valate filiform papilla. And you can see these are the taste buds. The taste bud appears like this. You can see this is the taste bud. The taste bud consists of, it is a circular or the globular structure with a central pore. This P is for pore. This is the pore, and these are all the cells. We'll have two types of cells. One type is supporting cell, and the other type is what we call the sensory cell. The sensory cell is the cell which stimulates the taste, and it will have nerve endings. The nerve endings all they converge and form a nerve which carries taste. That is carried to the nerves of the tongue. We will see later. So these are the taste buds and the taste pore. Okay. Then you can see these are the different areas of the tongue where you can feel the different tastes. The bitter taste is in the posterior side, sour, salty, sweet is at the tip. So these all are perceived on the tongue at a different region by different papilla. If we see the ventral surface which is present along the anterior 2/3, you can lift off your tongue, and you can see in the mirror. You will see your tongue like this. You can see a central membranous structure from the floor of the mouth to the almost of the middle of the tongue. That is what we call frenulum. This is the frenulum, and on either side of the frenulum you can see a blue colored line in your own tongue when you see in a mirror. These are representing or what we can see through this mucous membrane is the deep vein of the tongue, what we call profunda lingual vein. So this is the deep vein of the tongue on either side of this. Lateral to that, lateral means outside to that, you can see a mucous fold, an irregular fold with small projections, finger-like projections, what we call plica fimbriata. That is called plica fimbriata. These are the. So if you see the frenulum at its base, on either side of the frenulum you can see small elevations like here. So those are called lingual papilla, and where you will see the openings of the submandibular salivary gland, which is present somewhere here. So under the mandible you will see submandibular gland, and its duct opens there into the lingual papilla. And you can see another fold horizontally from the central point to laterally. So this is the area, this is the fold which is lying over the sublingual salivary gland. There are 3 salivary glands, probably you know. So parotid gland is here, and the submandibular gland is here, and sublingual gland is here. So these three salivary glands, out of these, the submandibular salivary gland opens on either side of the frenulum, and the sublingual salivary gland opens over this fold. So these are the things what you see. This is, you can see, we just removed the outer layer on one side. You can see the deep lingual veins, and fimbriated fold is there, we removed that, and you can see nerve is there, deep lingual nerve is there, and you can see the openings of the submandibular gland and sublingual salivary glands. These are the frenula of the lips, and this is the frenulum of the tongue. This is what we see under our tongue. Sometimes this frenulum may extend up to the tip of the tongue, which causes difficulty of the tongue to move. That's what we call ankyloglossia, or simply tongue tie. So this is the condition what we call tongue tie, where it will be somewhat difficulty the person will face difficulty in speaking. So he may not pronounce certain words properly. So the remedy is to surgically set right this, which is a minor surgery. So ankyloglossia are the tongue tie. So this is what is a defect with the frenulum. So if we see the post-sulcal part, that means behind the sulcus terminalis, or what we can call posterior 1/3 of the tongue, that surface is also very irregular, but it will not present so clear papilla. Even though the circumvallate papilla or the vallate papilla are present in front of the sulcus, in human body they are almost seen behind or in the pharyngeal part. So, and you can see the surface presents so many irregular elevations which are having groups of lymphocytes. The lymphocytes are the blood cells which are causing the immunity, and these are called lingual tonsils. So these are all lingual tonsils are there here, and that is present on the posterior side. This is what we call 20 to 30 aggregations of lymphoid follicles called lingual tonsils. So this is the present in the mucous membrane, and few taste buds are also scattered among them, and also on the valvula, this posterior wall, roof of this soft palate, and everywhere you will see small quantity of the taste buds, and you can perceive a little taste sense in that area. And if you see the next layer or the next tissue is the muscular tissue, the muscles of the tongue. The muscles of the tongue, just what we mentioned, the tongue is an organ which causes not only for which is useful not only for the taste, but it also useful in mixing the food and the speech. For speech or the mixing food, the tongue has to move in different direction, and that should be voluntarily done. So voluntarily done, so voluntary muscles are the skeletal muscles which are present here. The skeletal muscles, and they are also scattered in different directions. Why this arrangement is there? Because during speech, particularly if you observe certain words, you have to twist the tongue, you have to fold the tongue backwards or forwards, you have to make it convex, concave, or you have to protrude out, you have to touch the lips, you have to touch the tongue. So different directions, directional movements are needed. So to provide those movements, the skeletal muscles are present. So what are the skeletal muscles? They are arranged in two groups, what we can call extrinsic group and intrinsic group. What is extrinsic group? The extrinsic group means those muscles are coming from outside, and the intrinsic group of the muscles are present within the tongue only. So the extrinsic group are present are coming from the outside. They are named as like this. So the name says from where they are coming. The genioglossus, the genio denotes the mandible. So they are coming from the mandible. Hyoglossus from the hyoid bone. Chondroglossus again from the hyoid bone. Styloglossus from the styloid process, and palatoglossus from the soft palate. So they are starting from some other part, and they are ending in the glossus, that is the tongue. So that's why they are named as extrinsic muscles. And these intrinsic muscles are born within the tongue, and they are ending also within the tongue. Usually for those who don't know what is origin and what is insertion, a skeletal muscle usually have 2 points, two attachments. One is what we call origin, and the other one is called insertion, depending on the movement. So here the intrinsic muscles are superior longitudinal muscle. The name says it is superiorly present and longitudinal, that is a long muscle, and inferiorly present longitudinal muscle, so inferior longitudinal muscle, and the transverse muscles, the transverse linguae, that says it is transversely arranged, and this is verticalis linguae, that says it is the muscles are vertically present. So we will try to see what are the muscles and how they are arranged. You can see this is the genioglossus. If you see, this is the chin of the mandible. Mandible is the lower jawbone, and this is the chin, mentum. So behind the bone, this is the mandible bone, and you can see small projections, what we call the genial tubercles, or the mental tubercles. Both names we can use. So genial tubercles will be appropriate for this word. So there are two pairs, one is upper pair and one is lower pair. From the upper pair, this muscle originates. The muscle originates, and remember, this is a fan-shaped muscle. So it has an upper fibers. So the upper fibers run upwards and they insert under the mucous membrane of the tongue. This is the tongue. So they insert under the mucous membrane, and the lower fiber, the middle fibers, they run horizontally, and they form the bulk of the tongue, and they also go backwards and they insert somewhat into or continues with the middle constrictor muscle, which is a muscle of this is the middle constrictor, that is a muscle of the pharynx, the throat. So these are the middle fibers, and the lower fibers, they arch downwards and attaches to the hyoid bone. So this part forms the root of the tongue. So this is another muscle, geniohyoid muscle, from the lower genial tubercles to the hyoid bone. This does not involve in the formation of the tongue. So only up to here. So the why this muscle is so important? This genioglossus forms the bulk of the tongue. So the entire tongue bulk is formed by the genioglossus muscle itself. All fibers, they scatter along the entire size of the tongue, and they interlace with the other muscles. Remember this, they interlace with the other muscles, and these muscles are the muscles which causes the protrusion of the tongue. So we can protrude our tongue outside the mouth, and that's why it is very important. And its action, you see, if you observe this action, the genioglossus brings about the forward traction, what we call protrusion. Its effects from the mouth, we can do like this. If one side muscle is active, so here the left muscle is active, so the tongue is deviated to the right. If both are active, we can protrude tongue equally outside the oral cavity. And you can see this word, safety muscle of the tongue. Why it is safety? Because if we sleep on our back, always there is a danger of our tongue to fall into our throat, causing respiratory disturbance, what we call choking. Sometimes death may occur. So this muscle protects from that danger. That's why it is called safety muscle of the tongue. So this muscle prevents the tongue to fall into the throat and prevents choking. That is why it is so safety muscle of the tongue. Then another muscle, what we call hyoglossus. The name says from the hyoid bone. This is the hyoid bone. Here, at the junction of this floor of the mouth and the neck, you can see a small bone. You can move it like here. So that is don't crush it. So that is hyoid bone. The hyoid bone has a body here. If you see the pointer, this is the body, and these are the cornua. There are two types of cornua. One is larger one, that is greater cornua, and a small one will be here, that is lesser cornua. So from the entire greater cornua and a part of the body, the muscle takes origin and runs upwards, and that inserts along the side of the tongue under the mucous membrane. This is the side of the tongue, and at its insertion, that means its ending point, it blends with the another muscle from the styloid process. This is the styloglossus muscle. So this muscle, the hyoglossus, inserts with the styloglossus on its lateral side, that is outer side, and we mentioned one intrinsic muscle, the inferior longitudinal muscle, that is on its other side, that is the medial side. So towards the center is the medial side, towards the outside is the lateral side. So that is the insertion of this hyoglossus muscle. Relation of hyoglossus and that's everything else, we have discussed those things in the chapter of the carotid triangle and the other topics. So here only we are talking about its attachments with the tongue only. So this is the hyoglossus. So chondroglossus, that is a detached part of hyoglossus, because the hyoglossus muscle, if we see here, this is the hyoglossus muscle. This genioglossus, while passing backwards, it separates the muscle into two layers, between which you will see if you see there is a gap between the hyoglossus muscle. So the outside muscle is the hyoglossus and the inner part is the chondroglossus, between which you will see this genioglossus passing. So these two muscles, if you see, the origin is lesser cornu of hyoid and insertion is side of the tongue. Both hyoglossus and chondroglossus, what they do, they depresses the tongue by sides. So you can make the tongue surface into a concave surface side to side. So they depresses the sides. That is the action of this hyoglossus and the chondroglossus. Next, you will see the styloglossus, another muscle. You can see the styloglossus from the styloid process. This is the small spine-like process will be there at the base of the skull, and from there few muscles are originating. Other muscles goes to the hyoid bone, pharynx, etc. So we are not talking about those things. Only we talk about from its apex. You can see the muscle is coming like this and inserting lateral to this hyoglossus to the side of the tongue. So if you observe, it has a oblique fibers and a straight fibers. These oblique fibers continue with the hyoglossus muscle, and the straight fibers, they blend with the inferior longitudinal muscle which is present on the other side, so that side. So this muscle has two types of fibers. So what this muscle does, this muscle do, its action is styloglossus draws up the tongue up and backwards. So the protruded tongue can be pulled inside the mouth with the help of this styloglossus muscle. So another muscle is palatoglossus muscle. The name says from this palate. So we have two types of palate, the hard palate anteriorly and soft palate posteriorly. So from the soft palate, you can see this is the hard palate and this is the soft palate. From the soft palate, you can see this muscle is going down and it inserts onto the side of the tongue. So over this muscle you will see the mucous membrane. If you open the mouth, if you can see here, this is the mouth of a kid. So you can see this is the tongue, and behind that, that is this white one is the epiglottis, and this is the uvula. Everybody knows that uvula. And you can see these pillars. These pillars are coming from the side of the uvula to the side of the tongue. This is called palatoglossal arch. This is the mucous membrane. So this, and you can see these tonsils. At least you can identify your tonsils. So in front of the tonsils, you can see this fold. So this is the palatoglossal arch, and this mucous membrane covers the muscle what we named as palatoglossus. So from the soft palate to the side of the tongue. So what is the action of this muscle? So palatoglossal arch, and you can see this continues the tongue and it lifts the tongue, it holds the tongue like a sling. Usually, actually this muscle or this arch is meant for to close the pharyngeal isthmus during what we call swallowing. So during swallowing we have to stop our breathing for a moment. So that is helped by this palatoglossal arch from above. So now coming to the intrinsic muscles, and among them is the superior longitudinal muscle. Before going into that, I would like to say one thing, that the muscle what we call the tongue is divided into, one minute please. consists of a fibrous septum, because during development the tongue developed from two sides, and the tongue consists a fibrous septum which is dividing the entire tongue into a right and left halves. So that's what we call median fibrous septum. So it this muscle, superior longitudinal muscle, which is originating or which is located beneath the mucosa of the dorsal surface. Dorsal surface under the mucous membrane, we will see this muscle, and it arises from the posterior part of the median fibrous septum, and it diverges forward like this, and that inserts along the under the surface of the mucous membrane into the sides of the tongue anteriorly. So posterior fibers, they attach anteriorly, a little bit anterior fibers, they go little bit forward. So it reduces the tongue. So if you want to make your tongue shorter, so that this muscle helps. This is the superior longitudinal muscle. So you can see from these fibers, they are starting from here, and they diverge. This is a section you can't see the divergence, but this is the superior longitudinal location of the superior longitudinal muscle. Remember, all the muscles interlace with each other, so they travel through one another, and they move freely also. They are not fixed to each other. So this is the genioglossus muscle. This entire thing is the genioglossus muscle. You can see that is going through these superior longitudinal muscle. In another section, you can see the fibers, these horizontal fibers. You can see these are the superior longitudinal muscle fibers. This is the hyoglossus. You can see this is the hyoglossus, and this bulk is the genioglossus muscle. So both sides. So this is how this is the cutting of tongue like this, and you are viewing from front or back. So this is the view. You can see here. And coming to the inferior longitudinal muscle, this will be a little bit opposite to the superior longitudinal muscle, because this lies beneath the mucosa of the undersurface of the tongue, deep to the insertion of hyoglossus. Just now we mentioned that the hyoglossus inserts on one side of this inferior longitudinal muscle. So this arises from the posterior part of the sides of the tongue, and that converges forward and attaches to the median fibrous septum in the anterior part. So again, it shortens the length of the tongue, makes the dorsal surface convex from side to side. These are the functions of this muscle. So you can see here, this is the hyoglossus, and you can see this is the inferior longitudinal muscle. Superior longitudinal muscle is in this part. This is inferior longitudinal muscle, and the other two parts, transverse linguae, again arises from the median fibrous septum, that is in the center part of the tongue, and they diverges laterally. So they pass laterally through the genioglossus and inserted into the side of the tongue. So they are inserted into the side of the tongue here. So, and action reduces the width of the tongue and increases the length of the tongue. You can see the other muscle is verticalis linguae, arises from the lamina propria of the dorsum of the tongue and passes downwards through the fibers of genioglossus and curves laterally and inserts into the sides of the tongue. So it comes like this, in this fashion. So this is the, you can see both muscles in a diagrammatic view. It appears like this. You can see here, this is the horizontal muscles or the transverse linguae, and these are the vertical linguae, verticalis linguae. Vertical muscle fibers are there, and transverse muscles are like this. So these are the intrinsic muscles, and you can see here all the arrangement, how the muscles are arranged here. So if we see, these all muscles are bound together by means of a connective tissue. So, and also that helps in the passage of blood vessels and nerves, lymphatics, etc. And this also consists of adipose cells, fat cells are there, serous acini are there, mucous acini are there. If you see a section under a microscope, you can see the adipose tissue, serous acinus, mucous acinus, and you can see these are all the muscle fibers in different directions. You can see the mucous membrane, which is presenting elevations, and these papillae are present on the dorsal surface only. Ventral surface you won't see these papilla. So this is how the tongue muscles are arranged, and And now we talk about the nerve supply, which is very, very important. So if we see the nerve supply can be divided into two types based on that: motor supply and sensory supply. What is motor? Motor means the movement of the tongue. The movement of the tongue, we have to voluntarily move the muscles. So that motor supply can be studied under different headings. Somato-motor, that is body wall. Somato means body wall. That means skeletal muscles. Those are the movements of the muscles. All the muscles of the tongue are supplied by one nerve, what we call hypoglossal nerve, which causes the movement of these muscles, except one muscle, that is the palatoglossus, because this belongs to the soft palate, and this muscle is supplied by the cranial part of accessory nerve, that is a cranial nerve. This is also cranial nerve, and that is the 11th cranial nerve via the pharyngeal plexus. This is the path by which it gets its, this muscle palatoglossus gets its nerve. So these are the what we call with the help of this hypoglossal and the accessory nerve, we are moving our muscles of the tongue. Then comes secretomotor. Secretomotor means which induces the secretion of the glands which are present within the tongue. You can see the anterior part of the tongue that receives, if you see for time being, secretomotor fibers are from the autonomic nervous system, and that has two components, parasympathetic and sympathetic. So out of that, parasympathetic induces the secretomotor fibers, and that will have a preganglionic fibers and postganglionic fibers. So the preganglionic fibers are coming from superior salivatory nucleus, which are and from there to the facial nerve, and from there chorda tympani branch, and from there lingual nerve relate to the submandibular ganglion. Remember, there is a ganglion here, and from there the postganglionic fibers pass through the lingual nerve, reach the glands within the tongue, and they causes secretion of those glands. And vasomotor, almost opposite to this secretomotor function, and those are derived from the sympathetic fibers, which are always pass around the arteries of that organ. So here the lingual artery carries those fibers. So three types of motor fibers. One is somatomotor, secretomotor, and vasomotor fibers. Then coming to the sensory supply. So sensory, most important function of the tongue is the sensation of the taste. So from anterior 2/3, general sense is there also. So if we bite our tongue, you will feel the pain, the heatness of the liquids or the food. So these are all carried by means of, that's what they call general sense. These are all named as general sense. These general senses are carried by the lingual nerve itself. The lingual nerve is a branch of mandibular nerve. Again, that is a branch of trigeminal nerve. So from the lingual nerve into the mandibular nerve, from the trigeminal nerve and their sensory nuclei. And the special sense of taste. This is the special sense of taste. Even though the violet papilla are on the anterior 2/3, those are not connected by this chorda tympani. The chorda tympani nerve is a branch of facial nerve, and that carries taste sensations from the all the papilla of the anterior 2/3 of the tongue, except for violet papillae. If we see the posterior 1/3, both general and special senses are carried by the another cranial nerve, 9th cranial nerve, that is glossopharyngeal nerve. The violet papilla are also getting are innervated by the glossopharyngeal nerve, which carries the taste sensation. So vallecula by internal laryngeal branch of superior laryngeal nerve. These are the nerves which are connected to the tongue. One more thing most important for the tongue is it has to maintain its position, because it is staying in between the T2 teeth. So to prevent from being bitten by the teeth, it has to maintain its position, what we call a proprioceptive sense. This proprioceptive sense from the muscles of the tongue is carried directly to the mesencephalic nucleus, which is present in the midbrain through trigeminal nerve. This is the specialty of the tongue position. proprioception is very important for the tongue. So then comes, you can see the blood vessels. You see the lingual artery. The lingual artery is the principal artery of the tongue, which is a branch of this external carotid artery. So this is the branch, and you can see that the other branches are also there. Those are the ascending palatine and tonsillar branches of the facial artery, and the ascending pharyngeal branch of the external carotid artery also. They provide blood supply to the tongue. The lingual artery divides into branches. Out of them, dorsal branches supply the posterior 1/3, and profunda lingual. The profunda means deep. Deep lingual branch supplies the rest of the tongue with its branches. It has a number of branches will be there. That's why a small bite will cause profuse bleeding from the tongue. So these are the artery, and comes the vein. The veins are arranged into two sets again: superficial set and deep set. Superficial set, they directly drain into the internal jugular vein, and the deep branches, they may join this vein or they directly drain into the internal jugular vein. So ultimately the veins will drain into the internal jugular vein. The course or the path may be somewhat different, but they drain into the internal jugular vein. You can see this is the view of the blood vessels, and you can see this is the lingual nerve and submandibular ganglion, which is providing the secretomotor fibers. Then comes lymphatic drainage, is very important for the tongue in aspects of surgery and oncology. So here what we understand here in this video is the lymphatic drainage consists of intramuscular plexus and submucous plexus. So the plexus means group of lymphatics within the muscles or under the mucous membrane. So they are arranged in four sets: apical sets near the tip, marginal sets on either side, and central set, and dorsal, and that means that is the posterior part, basal part. So four sets are there. Whatever may be the connections, they directly or indirectly, the final termination of these lymphatics is as follows. Like what? Some drain into the submental lymph nodes here in this region, few directly into the jugulo-omohyoid. So this is the jugulo-omohyoid part lymph nodes. Some into the submandibular lymph nodes, and some into the jugulo-digastric in this region, or jugulo-omohyoid a little bit below. So these are the groups of lymph nodes which are present in the neck, and they all drain into these only. From each group again they drain into the other groups. So this is how the lymphatics drain from the tongue. Why it is important? Because you can see this. These are the lymphatics which drain into so many groups of lymph nodes. So particularly from the apical region, the tip. So that is important because the lymphatics of the remaining part of the tongue, they drain into their respective side, but the tip will drain bilaterally. So any cancer of the tip may spread bilaterally. That's why it is important. That is the specialty. And you can see so many decussations. That means they may cross to the opposite side and they drain into the lymph nodes of the other region. So these are all things you can see. And anatomically, we will consider a group of lymph nodes at the bifurcation of common carotid artery at the principal lymph nodes of the tongue. So these are the lymph nodes. So and with this I'll stop this video, and development and the detailed microstructure we will make another video, and that will be dealt in next video. So please like this video and share it with your friends, and please subscribe to my